Good afternoon to you all. I am Dr. Anoop Gopinath, Consultant Interventional Cardiologist, Medicina Wellcare Heart Center, Palakkad. The talk of the day in Kerala is usually the burden of ischemic heart disease. A large number of people suffering from heart attacks come to hospital daily to take treatment. It was a problem that was seen in population above 50 years of age earlier, but now the age for getting a heart attack is declining and lots of patients are coming to the hospital between 30 and 50 years of age. It is said that coronary artery disease in Asian population occurs a decade earlier than the counterparts in the West. Ischemic heart disease is divided into two major groups of diseases. One is stable ischemic heart disease and the other is acute coronary syndromes. The problem in any part of India is people fail to recognize the symptoms of cardiac disease. Different types of symptoms come which are not recognized by the usual people, and a lot of mortality comes as a result of it. Some people present to the casualty with gastritis, recurrent episodes of gastritis, not having any typical chest pains. There is another group of people who presents with acute pain with severe sweating, who are recognized and then brought to the hospital emergency and they get proper treatment. There are several risk factors for the development of ischemic heart disease: diabetes, hypertension, age, gender, sedentary lifestyle, family history of heart disease, and dyslipidemia. Most of these risk factors are now modifiable. However, age and family history of disease are non-modifiable risk factors. The problem is ischemic heart disease is affecting the young population in their actively working age. The exact reasons to these are still not known, but it is still thought that a large number of these risk factors are affecting younger populations. The environmental transition, that is, there is a sudden change in the lifestyle in today's world, but the genes are still old. So the genetic makeup has not progressed to the level of the environmental changes and the lifestyle changes that people have taken into account. There are several people who have acute MIs. They fail to recognize the symptoms. They sit at home, bring them to the hospital at a later time, and we are not able to save such patients. It is said that any pain above the umbilicus and below the chin, unless otherwise proved, can be a sign of heart disease. Patients who come with stable ischemic heart disease usually have angina, a pain that is present in the central chest, radiating to the left upper limb, relieved either by rest or by giving nitrates. But if a patient has such a pain for more than 20 minutes, you call it as an acute coronary syndrome. Acute coronary syndrome patients recognize because they have an intense chest pain with sweating. Immediately they are rushed to the hospital. The idea is absolutely not in taking the treatment for this disease, but it is for the prevention of such diseases. Patients who have risk factors like diabetes, hypertension, dyslipidemia, or a family history of heart disease should start looking for heart diseases right from the age of 30 years. They can just get a lipid profile, a blood sugar, a basic baseline ECG, echo, and a treadmill test, which will help you to recognize the probability of getting an ischemic event in the next 3 or 4 years. Usually, patients with diabetes patients with hypertension, elderly individuals, may not be very much symptomatic. The amount of blocks that they have may be disproportionate to the symptoms that they have. A large majority of patients in young age, say around 30 to 35 years of age, are seen now with triple vessel disease without any symptoms. Trying to find out such patients and giving them a proper treatment for future is what we are aiming at now, so that the age at which these people work, we can improve their health standards of the community and help people understand more and more about the disease process. A patient coming with acute coronary syndrome reaching a hospital immediately is treated, taken to the cath lab. Patient is prepared for a primary angioplasty, and usually in a place like Kerala, where there are a large number of cath labs around, it becomes a very easy job. Patients are immediately given treatment and they are given long-term secondary prevention for the same. But still, even a place like Kerala, where people are very much literate, people know about cardiac diseases, still only around 10 to 15% of patients get proper treatment for ischemic heart disease. The rest of the people do not recognize the actual symptoms and signs of ischemic heart disease. So ischemic heart disease is taking a heavy toll on the population in terms of mortality. It is probably because of the rising risk factors in younger age group. The prevalence of diabetes has increased in the younger age population. The lifestyle has changed. It has become more sedentary, and even eating habits has changed. Now, how can you prevent these diseases before it attacks you? Early recognition of risk factors like early recognition of diabetes, early recognition of hypertension, early recognition of the fact that you have an ischemic heart disease without symptoms by doing certain tests right from young age, like from around 30 years of age, to detect if patient has an underlying coronary heart disease will help the future. Apart from ischemic heart disease, we also have a large number of congenital heart disease being easily recognized now. Even after the birth of a child, in the neonatal period itself, because of constant echoes being done, we find a large number of patients coming up with atrial septal defects, ventricular septal defects, who, if we treat at appropriate time, may not go into complications at a later stage of life. The other part of cardiology that we usually deal with is structural heart disease. Patients coming with rheumatic heart disease. Although the incidence has rapidly declined in the state of Kerala over the last few years. Another part of cardiology is arrhythmias. Usually, patients coming with palpitations, sudden onset of giddiness, sudden falls, may have arrhythmic episodes. These are easily recognized because usually patients coming are symptomatic. Arrhythmias are detected, and we have electrophysiology labs around for checking and preventing and even giving treatment appropriately for these arrhythmias. So even though ischemic heart disease is the bulk of practice for an interventional cardiologist practicing in any part of India, recognition of congenital heart disease, structural heart disease, others will help improve the development of the health standards of a society in future. Thank you.